Namaste. I'm Jaya Daptardar. I'm Ayurvedic doctor, healthcare executive, writer of 3 Ayurvedic books, and I'm also a licensed esthetician. If you know more about me, you can browse by my name, Jaya Daptardar. So, thank you, Dr. Shekhar, for inviting me for this Global Ayurveda conference. It's my pleasure. So, my today's topic is autoimmune hepatitis, Ayurvedic concept. Let me share my presentation with you. Okay, hope you can see it now. Okay, here you go. So I have a little disclaimer before we go further. So this whole presentation is to provide educational information about Ayurveda. This information is not intended to use for treatment, cure of any disease. If you have any serious, acute, or chronic health concerns, please consult your family physician or healthcare provider who can fully assess your individual needs and provide the care that you require. The contents of this presentation or workshop may not be produced in part or the whole without the permission of the author. Okay. So, what is autoimmune hepatitis? So, autoimmune hepatitis is a disease of the liver that attacks a person when their immune system turns against their liver cells. So, this condition leads to a dysfunctional liver, which may cause disorders related to that particular organ. It is not known as to what causes this autoimmune hepatitis, but specific genes are believed to be the reason behind autoimmune hepatitis. So, this autoimmune hepatitis manifests in the form of necrosis, death of living cells of the liver, hepatocellular inflammation, and later on also culminates in cirrhosis of the liver. So, next slide, signs and symptoms. I would like to say, as compared to men and women, men are affected more by autoimmune hepatitis than women. So, in terms of signs and symptoms, weakness, weight loss, fever, stomachache, pain, and diarrhea, skin rashes, swelling, or edema. And when it goes into jaundice, then you will see yellowing of the skin or eyes, those symptoms. They're similar to any hepatitis. So, what is Ayurvedic concept, right? Because there is no specific autoimmune hepatitis mentioned in Ayurveda. So, in any disease, Ayurveda's theory is totally different. So, what we do, we correlate that with Ayurvedic concept. So, in Ayurveda, autoimmune hepatitis can be compared as elevated pitta in the liver, excess or increased pitta in the liver. Pitta participates in the activities related to metabolism in the gut. So Pitta is a part of digestive process. So when Pitta gets vitiated, it starts destroying the body components, the cells and the organs in which it is produced and stored, in the areas in the parts of the body where it is functional, or in the channel in which it is transferred or carried. So um, this is Ayurvedic concept. And Pitta, what happens when Pitta goes into vitiated state? So this aggravated Pitta, when gets into vitiated state, it can trespass into the regions of the body which belong to the other doshas, Vata and Kapha, because then it just doesn't know at that point the direction that the Pitta used to go. It just trespasses into the other regions. Whichever parts of the body comes in contact with vitiated Pitta get inflamed. So Pitta itself is a fire. It causes inflammation wherever Pitta aggravates or elevates. So this active inflammation, which becomes chronic over a period of time. So what happens with that when the Pitta gets over aggravated in the liver? It will damage the liver anatomically and also disturbs its functions. So when the effect of Pitta when effect of Pitta in the circulation, systemic symptoms like pains or fatigue or edema, that those symptoms are seen. So the Pitta, which is supposed to be protective, now became destructive. So this is nothing but the autoimmune process. So Pitta is not differentiating between its norm, basically, and is just getting off track and starts damaging the body components. So, next slide. Importance of liver functions in Ayurvedic perspective. So, liver is an important organ in the body which not only participates in the digestive process but also takes part in the um, detoxification or filtration of the toxins. So liver filters all the toxins or unprocessed things coming through it. So this filtration process prevents those toxins going into the circulation and consequently damaging, the vital organs in the body. So that filtration prevents that. So liver also filters the toxins from the circulating food essence, like we say rasa rakta. So passing through it by means of portal circulation. And liver is also an important hemopoietic organ and helps in formation and maturation of blood cells. According to Ayurveda, liver along with spleen forms the roots of Raktava Srot, the roots of the channels responsible for carrying blood throughout the body, blood vessels. So liver is also the main site of one of the subtypes of pitta, which we say ranjak pitta. So this pitta imparts color to the blood and also helps in digestive process. So because it imparts color to the blood, we say ranjak pitta. So ranjak pitta is said to be responsible for thrust with which the heart pushes the blood to various corners of the body. So ranjak pitta along with Vyanavayu helps blood to circulate throughout the body. So my next slide, I already spoke about it. So pitta gets vitiated in liver. So the pitta causes inflammation of the liver and the other body parts as well, and then it sets into autoimmune process in the whole body, which causes this autoimmune hepatitis. So uh, the immunity is at its best and balanced when vata, pitta, and kapha are functional and operational in their, prospective zones. So the harmonious balance of these three doshas is immunity, and the vitiation and mutual affliction of the doshas leading to damage in the tissues and organs of the body is the onset of autoimmune process. Pitta represents fire, and that's why it causes inflammation. Vata represents uh, air and wind. That's why it causes the force or dryness. And kapha, it's solidity or the water bodies. So next slide. Let's go to the next. So when pitta is elevated in the liver, it evaporates the kapha, which is responsible for the integrity of the body and is the main immune component. Kapha is the main, it is support, it is main immune component. So the tissues which are rich in kapha, that is rasa, which is like lymph and plasma, mansa, that is muscle, maida, fat, majja, bone marrow, and shukra, semen, are vitiated by pitta, where in the inflammatory process sets in and the tissue integrity, strength, and immunity is lost. So at that time, this kapha becomes evaporated, and so it's a strength. Kapha is a strength. So immunity gets lost when that process happens. But the reverse is also possible. When kapha depletion leads to lack of support and buffer system to the body, it leads to vitiation of vata and pitta, because then it causes dryness, right? With severe pitta vitiation and kapha depletion in the liver, excessive tissue degeneration and dryness sets in, on the other hand. So the dry, let me go to the next slide. So the dry backdrop is helpful for vata vitiation. So this vitiated vata further destroys the liver and damages and leads to the conditions like cirrhosis of liver, which is irreversible. The reverse is also possible when vata getting vitiated further provokes pitta, like the combination of air and fire, and depletes the kapha components. So depletion of kapha or water components depletes the support system and buffer system of the tissues and organs, and leading to many systemic damages or disorders and loss of immunity. So this sets in the autoimmune process in the liver, causing autoimmune hepatitis. So the pathological process simultaneously runs in the whole body. So what is the Ayurvedic protocol or the treatment? Obviously, this is we're talking about elevation of pitta. So pitta is increase in the body. So what needs to be done is pitta har chikitsa. That means pitta level needs to go down. The elevated pitta needs to calm down. So avoid pitta vitiating food and lifestyle practices. Elevated pitta in the liver or anywhere in the body predisposes the inflammation, because that is the quality of pitta. This inflammation causes autoimmune disorders, and when the process occurs in the liver, it causes, like I said, it causes autoimmune hepatitis. So all the possible uh, causative and triggering factors of increasing pitta or pitta vitiation shall be avoided. So excessive consumption of pungent food or sour food or corrosive food, which is like tikshna food, intense acting food, should be avoided. Then Ayurveda is all about mind, body, and soul balance, right? So this is not just the doshas, but also the pitta in the mind needs to be controlled. So krodh, anger, needs to be controlled. Then no fasting, because fasting creates aggravation of pitta and aggravation in the mind as well. Sometimes, not all the times, but exposure to sun needs to be avoided. Excessive sexual indulgence needs to be avoided. So Ayurvedic protocol is mostly lifestyle management, food management, what needs to be done and what needs to be avoided. Um, because this is a autoimmune disorder. There is no 100% cure for that, but to manage um, in the life, it just it will be there, but it needs to be managed all the time. So managing vitiated pitta. In Ayurveda, panchakarma is like a mantra. When doshas are elevated, it needs to be controlled, it needs to be taken out of certain by certain procedures, and panchakarma is one of them. When dosha gets in that phase, vitiated phase. So through the panchakarma procedure, vomiting and enema and virechan, which is purgation, raktamokshan, which we don't do here, but we can do Shirodhara and all the meditation and yoga just for the mind to get balanced, the pitta, aggravated pitta in the mind to get balanced. And anytime when we do panchakarma, after there is a procedure before and after. So before also we need to make sure that we start this balancing process in the body. The eating habits need to be changed. um, Lagu with simple food, lagu ahar. And after the panchakarma also, you cannot get back to your routine right away, go to gym and eat whatever you want, but it is a slow process of eating the food which is very um, uh, digestible. It's not heavy. So old rice is recommended, old barley is recommended, lentil soup, and then what needs to be done, what needs to be avoided. Those things should be strictly followed. All pitta elevating measures should be taken, as discussed before. Pitta vitiated food to be avoided, and again, not to stress, worry, or grief. That's the balancing pitta uh, in our mind. Next slide. Maintain good digestion and stress level. So in Ayurveda, digestion, gut health is very, very important, because if the digestion is not good, it produces ama, and when ama accumulates in the body, it just becomes toxin and just gets spreaded into all over the body. When that happens, it affects our mind and the stress level. And when that happens, it affects the whole immunity in the body. And that is the reason the first thing we need to make sure is improve the digestion. Good digestion leads to good immunity. Maintain a stress level. Good life. Good lifestyle management uh, is is the answer. So the next slide, the other therapy options. So Svedana is also a part of Panchakarma, but it can be used as a separate therapy option. A natural detoxification treatment, which Svedana refers to sweat generation therapy. In this therapy, the patient is made to sit in a closed steam chamber, and it's warmed with the help of steam. The steam is created, and that carries the aroma of several Ayurvedic herbs. So these herbs induce sweating in the patient, thereby removing the toxins sitting in the body, inside the body. Later, the patient is given a gentle massage to relax the body. Um, Another thing that I learned in my research, apple cider vinegar. This gives relief in the case of autoimmune hepatitis by reducing the ammonia level in the body. High ammonia in blood is believed to cause imbalance in the body, and this imbalance disturbs the immune system, causing it to turn against the body. So now the herbs. Now it's time to discuss the other herbs. So milk thistle, Silybum marinum. It's very important in this autoimmune hepatitis because it has properties that strengthen the immunity of the body. It also contains the flavonoid called silymarin, which protects the liver from toxins. It is antioxidant, and that helps, that keeps the liver damage in check, and the anti-inflammatory agent in it that brings relief to the edema, the swelling part. Then giloy is a very important herb, Tinospora cardifolia. This is a very potent herb that boosts the immune system. Basically, it balances the immune system of the body by increasing the fighting power of a particular type of white blood cells. It also balances the pH level of the body. It is a natural diuretic, and then it increase. So because of the diuretic quality, it increases the secretion of urine, helping to flush out the toxins from the body. And being anti-inflammatory and analgesic in nature, giloy controls the swelling, and also gives relief from the pain eventually because swelling gets down. Then the golden spice, turmeric, which we all know that turmeric is a natural immunity booster, that is known to carry the compound called curcumin. This compound is a cleanser and a purifier. The liver and so it it purifies the toxins. It removes the toxins and purifies from the body and the blood. So that is more important. This relaxes the liver and also restores the normal functions. Um, what to avoid? Ayurvedic treatment is more about the lifestyle management and what to avoid. So, autoimmune hepatitis, like I said, is a disease that can be managed with Ayurvedic remedies, but one also needs to make lifestyle changes to keep body's immunity in a good shape all the time. Abstinence from alcohol is important. Avoid smoking and heavy protein stuff, food, spicy food. Spicy foods are beneficial, but the heavy food should be avoided. And it's regular exercise, yoga, and meditation is helpful. Plenty of water intake is needed and recommended. This steps automatically increase in the immunity of the body and keeps the disease check. So, in case of um, any concerns that you might have or your patients might have, you can consult the primary care provider of yours or your patients and continue Ayurvedic lifestyle management in integration with whatever treatment you are taking. Um, so, so this is all about the Ayurvedic concept for autoimmune hepatitis. Thank you very much for listening, and I hope you have learned some more about autoimmune hepatitis. And thank you, Dr. Shekhar. It's my pleasure. Thank you.